Very good morning to you. Tell us why this is happening, why treatment is so scarce.
Hi Jane, thanks for having me. Yeah, I think access to mental health care services in South Africa are just so scarce, and we're in such a dire need of changing the statistics around this. Like you said, only about 15% of people who need mental health care services will ever receive any kind of help in their lifetime. If we look at the healthcare budget, only 3% of the healthcare budget is allocated towards mental health care services. So you've got statistics like 0.69 psychologists to every 100,000 people in the South African context. And so you've really got to start thinking differently about how we provide mental health care to the South African population.
It seems that it's just not been taken seriously. I mean, we've seen the evidence. So many people take their lives under these circumstances. So you just wonder what's holding that back.
Yeah, I think more and more mental health is being acknowledged globally and locally as a serious health issue within the country. And yet we don't really see things changing in terms of the kind of impetus behind that to change these statistics. And the thing is, we can't really divorce mental health from the other social ills that exist within our context. We heard Prof. Nikak speaking earlier about crime, unemployment, gender-based violence. These all come hand in hand with mental health care, and we really need to start taking it seriously if we want to see things change within the South African context.
Do you think it's cracking the stigma that surrounds it that could be one of the keys?
I think stigma is still a huge issue that we deal with on the African continent and in South Africa in particular. And I think there certainly are ways that we need to be working with mental health in South Africa in order to kind of undermine the stigma that still exists. They're really creative and innovative mental health interventions that we're seeing come out of South Africa and come out of Africa. Just one off the top of my head, we think about the friendship bench that has come out of Zimbabwe and that has now spread across the country and even globally, where the use of trained grandmothers who are more easily accepted than a mental health care worker within the culture. And this has been a really successful way of dealing with mental health and well-being in the Zimbabwean context. And so there are certainly ways in which we can be dealing with the stigma, and it's critical that we are dealing with the stigma that's associated with seeking mental health care.
Okay, that's interesting, isn't it? Because obviously the healthcare model needs to be changed. Maybe it is up to the community. Maybe they need to be empowered more.
Yeah, certainly. And I think that's definitely the angle that we have come from, that the kind of over-professionalized and individualistic medical model is important, and it has its place, and it certainly should continue to be supported and more supported than it currently is. But that there need to be alternative models. The scale of the problem in South Africa is so big that we have to start looking at alternative models to intervene in mental health. And the route that we've really taken here is a community approach. You know, there are community members who have significant knowledges, who have skills, who have abilities, and we need to be tapping into those if we're going to create any kind of sustainable solution to dealing with this large-scale problem in South Africa.
Jacqueline Notter, good to talk to you. Thank you.